Good day. Now that the fifth seminar on health diplomacy has come to a close, I'm pleased to interview Dr. Ala Alwan, WHO's Regional Director for the Eastern Mediterranean. Thank you so much, Dr. Alwan, for your time. The seminar has been attended by more than 70 senior officials from Ministries of Health, Ministries of Foreign Affairs, diplomats, parliamentarians. What are the major recommendations that the participants agreed on?
So let me say that we are really very pleased with the outcome of this seminar. The fifth time we do it. We started in 2012. And what is unique about this seminar is the seniority of the participants. So we have ministers of health, we have assistant ministers of foreign affairs, we have a large number of ambassadors, and ambassadors not just from their own capitals in ministries of foreign affairs, but also a number of ambassadors coming from Geneva. These are permanent representatives of their own countries in the United Nations in Geneva. So it's a very unique situation now we have, in that the member states are becoming much more interested in health diplomacy than 2012 when we first started. So the first recommendation focused on the importance of what we are actually doing, the importance of not only increasing awareness about the importance of health diplomacy, but also on the skills that the Ministry of Foreign Affairs and Ministry of Health officials and also parliamentarians need to practice self-diplomacy in support of their own national health priority. So it became absolutely clear from the conclusion of the seminar that the member states would like us to continue on this, would like us to scale up the work that we are doing. One of the recommendations related to this issue was to also organize national seminars in member states. The recommendation to organize a special session for the parliament in one country, a training session for diplomats in ministries of foreign affairs, and also multi-sectoral sessions in member states, which we will do hopefully over the next months and years. So that is one. We discussed a range of subjects. Subjects are of great importance at the global level, regional level, and also at the national level. So we discussed health security, and health security is top priority for every member state globally and also in our region. We discussed the epidemic of heart disease, diabetes, cancers, and chronic lung disease, the group of diseases that we call non-communicable diseases. We discussed the Sustainable Development Goals, recently endorsed by the General Assembly of the United Nations in September 2015. And we also discussed partnerships to serve the health diplomacy and the health interests of member states. And in each of these sessions, we came up with some concrete recommendations on how member states can, number one, improve and strengthen their skills in health diplomacy, and number two, on addressing the constraints that they have in moving forward in these areas. And one of the key concerns that member states have is the need for the active engagements of health, of non-health sectors. Now we have 5 key priorities in this region, and these 5 key priorities are health system strengthening, health security, non-communicable diseases, maternal and child health, and also emergency preparedness and response. And in each of these priorities, countries will not be able to make a significant difference without the active engagement of non-health sectors like the finance sector, the industry sector, the commerce sector, the education sector, transportation sector. So we had a great deal of discussion on how to engage non-health sectors. How do we implement what we call the health in all policies? That each sector or each agency within the government should think of health when they develop their own policies.
Dr. Alwan, you launched the initiative of health diplomacy 5 years ago. Are you pleased with the outcome, with the achievements that took place so far, and what still need to be done?
Well, I am definitely very pleased with the outcome, simply because I receive requests from member states that we continue. Member states were clearly very happy with the outcome of this seminar. They were happy with the outcome of the previous 4 seminars, and we have been formally asked by Ministries of Foreign Affairs, Ministries of Health, and also the Parliament to continue on this. It's a unique initiative. I think our region is doing more than other regions are doing in this area of work. So definitely yes, we're very encouraged by the response of the participants and also of governments, and we will continue to organize these annual meetings. The unique thing is that this seminar brings together Ministry of Foreign Affairs, the Ministry of Health, and also the Parliament. And they are discussing the same kind of issues. And each one of them has a major role to contribute or in addressing these important health issues.
If I'm a diplomat or I'm a parliamentarian, what shall I do to contribute to advancing the concept of health diplomacy?
I think clear understanding of the major challenges that face health development in your own country. And then what is your role as a parliamentarian in addressing this? Let me take one example. If the major cause of death in your country is the epidemic of non-communicable diseases, and this is the case in most countries of the region. Some countries have these diseases causing something like 80% of all deaths. And a good proportion of these deaths are premature deaths occurring before the age of 60 years, during the most productive period of people's life. So if you are a parliamentarian, you have a very clear role in helping and in contributing to address this epidemic. How do we lower the risk factors that cause non-communicable disease? And we know that in our own countries, these risk factors like tobacco use, unhealthy diet, physical inactivity, the harmful use of alcohol, they are increasing in magnitude. And so the Parliament is responsible for legislation. Legislations are needed for tobacco control. Legislations are needed for healthy diet. Legislations are needed in terms of creating an environment that promotes physical activity. Legislations are needed to prevent the harmful use of alcohol. And the Parliament is also responsible for assessing or evaluating the progress that the government makes in addressing these diseases. So monitoring the progress, evaluating the policies of the government departments. So the parliamentarian has a major role in this area of work. And the same with health system strengthening, the same with maternal and child health, where we have a challenge of reducing maternal mortality and child mortality in almost half of the countries of our region. Another example is with the emergencies that we see in this region. Always, more than half of the countries are affected by crises, emergencies, conflicts, and wars. Imagine, the role of the Parliament, the role of the government departments, the role of the Ministry of Foreign Affairs specifically in this. So each one of these three, and actually it's not just these three partners that we are inviting to health diplomacy. Every sector or every government department has an important role in addressing the 5 priorities or challenges to health development in this region.
Thank you so much, Dr. Alwan.
You're welcome.